The Elder Care Protection Bill has been signed into law, and if you are over 60 or if you have a parent, a spouse, or someone you love who is, this legislation is going to touch areas of your life that matter deeply. Healthcare costs, your monthly Social Security check, the quality of care in nursing facilities, your protection against the people who are out there trying to steal from you. This video is going to walk through what is actually inside this bill in plain conversational English, without any political spin and without any unnecessary alarm. Just the facts, the details, and the practical information you need to understand what has changed and what you should be doing about it. And before we get into any of that, it is worth saying clearly that this is not going to be a conversation about politics. People on both sides of the aisle have had things to say about this legislation. That debate will continue. What matters here is the practical reality of what this bill actually does for real people living real lives, and that is exactly where we are going to focus our attention. Before getting into the specifics, it helps to understand why this bill exists in the first place. Seniors in America have been navigating a system that in many ways was not designed with them in mind. That is not a political statement. It is just the reality that has played out over decades. Prescription drug prices in the United States have been among the highest in the developed world, and older Americans on fixed incomes have felt that reality every single month. Nursing homes have operated for years with inconsistent oversight and a history of violations that rarely resulted in meaningful consequences. Social Security adjustments have been calculated using a formula that does not accurately reflect how older people spend their money. And financial fraud targeting seniors has grown into what federal law enforcement describes as one of the fastest expanding crime categories in the country. These are not abstract policy concerns. They are things that have been playing out quietly in millions of households across America for years, often without enough attention from the people making decisions in Washington. This bill is a response to that reality. It is one of the more comprehensive pieces of legislation specifically focused on the needs of older Americans that has been passed in quite some time. And it covers a wide enough range of issues that almost every senior in the country will find something in it that applies directly to their situation. The people who wrote this bill spent years hearing from seniors, from caregivers, from healthcare professionals, and from advocates who work directly with older Americans every day. What came out of that process is a piece of legislation that tries to address the actual lived experiences of people rather than just the theoretical framework of policy. Let's start with prescription drug pricing, because this is the piece that affects the largest number of people and the one that has been debated the longest. For years, Medicare, the federal health insurance program that covers more than 65 million Americans, was legally prohibited from negotiating drug prices directly with pharmaceutical companies. To understand how unusual that was, consider that the Department of Veterans Affairs has always been allowed to negotiate drug prices. Private insurance companies negotiate drug prices. Hospitals negotiate drug prices. But Medicare, by far the largest single purchaser of prescription medication in the entire country, was not permitted to use that purchasing power to get lower prices for its beneficiaries. The result was that American seniors were paying dramatically more for the exact same medications that people in Canada, Germany, Japan, and most other wealthy nations were paying far less for. There was no medical reason for that difference. It was purely a function of policy. This bill expands and accelerates the Medicare drug price negotiation process. The list of medications subject to negotiation is significantly broader than under previous rules, and the timeline for when those negotiated prices go into effect has been shortened. The practical meaning of that for you is straightforward. If you are currently spending $200, $300, $400 or more each month on medications for conditions like diabetes, high blood pressure, heart disease, or arthritis, there is a genuine possibility those costs will come down, not eventually, on a rolling schedule that has already begun. The bill also establishes a cap on out-of-pocket drug costs for Medicare beneficiaries. That means there is a yearly maximum on what you will ever have to pay for your medications, regardless of how many prescriptions you take or what they cost. For people who have been rationing their medications because they simply could not afford to fill every prescription every month, that cap is not a minor policy detail. It is a real change in how manageable daily life feels. Think about what it actually means to walk into a pharmacy knowing that no matter what, your costs for the year will not exceed a certain number. That kind of financial certainty is something that millions of seniors have not had access to, and it changes the way you make decisions about your health. You stop choosing between which prescription to fill this month and which one to skip. You stop stretching a 30-day supply into 45 days because you are trying to make it last. You take your medications the way your doctor prescribed them, which means your health outcomes improve. That is the real-world downstream effect of this policy change, and it is one that is going to show up not just in people's bank accounts, but in their actual physical well-being. Social Security is the next major area this bill addresses, and it is one that generates a lot of conversation for good reason. Social Security has been the financial foundation of retirement in America since 1935. The program was built on a straightforward premise: you contribute during your working years, and when those years are behind you, the system provides a monthly benefit that helps you cover your living costs. Cost of living adjustments, which are commonly called COLA, are the mechanism designed to make sure that your benefit keeps pace with inflation over time. Each year, the Social Security Administration reviews economic data and adjusts monthly payments accordingly. The problem that seniors have been pointing out for many years is that the inflation measure used to calculate those adjustments does not accurately reflect how older Americans actually live and spend their money. The standard formula is built around the spending habits of urban wage earners and clerical workers. It weighs things like transportation, electronics, and work-related expenses fairly heavily. But retired seniors spend their money very differently. They spend a much larger share of their income on healthcare, on prescription medications, on home health aides, on assisted living costs, and on other services that are essential to maintaining independence and quality of life as they age. Those categories increase in cost faster than almost anything else tracked in the standard inflation formula. So for years, the annual adjustments that seniors received often underrepresented the actual increase in their cost of living. Over time, that gap compounds and erodes purchasing power in ways that are difficult to see all at once, but become very real when you look at a decade of accumulated shortfall. The Elder Care Protection Bill pushes for the adoption of an inflation index specifically designed to track the spending patterns of older Americans rather than working-age adults. If that change is fully implemented, your annual Social Security adjustment would actually reflect what your life costs. That sounds like a technical change, but it translates into real money over time. Even a small improvement in the accuracy of that annual adjustment, compounded over several years, adds up to hundreds, or in some cases, thousands of dollars more in your pocket. The bill also includes provisions aimed at strengthening the long-term funding structure of Social Security. Projections had indicated that the Social Security Trust Fund could face depletion sometime around the mid-2030s, which under existing rules would have triggered automatic benefit cuts across the board. That outcome would have been devastating for the millions of people who depend on Social Security as their primary or sole source of retirement income. The legislation addresses this by adjusting the payroll tax cap, meaning that higher income earners will contribute more into the system than they currently do. That change strengthens the financial foundation of Social Security, not just for people collecting benefits today, but for younger workers who will depend on the program decades from now. It is also worth noting that for many seniors, Social Security is not just a supplement to other retirement income. It is the entirety of their monthly budget. For those individuals, every dollar in that check matters in a way that is difficult to fully appreciate unless you are living it. The combination of a more accurate inflation adjustment and a more stable funding structure is genuinely significant for that population. Nursing home reform is another major piece of this legislation, and it is one that does not always get as much attention as drug pricing or Social Security, even though for families navigating the reality of long-term care, it may be the most personal and emotionally significant part of the entire bill. The quality of care in nursing homes across America has been an inconsistent and, in many cases, deeply troubling picture for a long time. Reports from federal oversight agencies have documented serious violations at a significant percentage of facilities nationwide. Understaffing has been one of the most persistent root causes of problems. When there are not enough trained caregivers to adequately attend to residents, the consequences range from unmet basic needs to preventable accidents to neglect, and in the worst cases, to outright abuse. Families who have placed a parent or spouse in a nursing facility knowing they had limited options have lived with the anxiety of not being sure their loved one was truly safe and properly cared for. This bill establishes minimum staffing ratio requirements for nursing homes that receive Medicare and Medicaid funding, which covers the vast majority of facilities in the country. That means there must be a defined, enforceable ratio of trained staff to residents. It also significantly raises the financial penalties for facilities found to be in violation of resident safety standards. Previous fines were frequently low enough that facilities treated them as an acceptable cost of doing business rather than a genuine deterrent. Under the new structure, fines are substantially higher, and repeat violators face the possibility of losing Medicare and Medicaid funding entirely, which for most nursing homes represents the overwhelming majority of their revenue. Losing that funding is not a manageable business inconvenience. It is effectively the end of the facility's ability to operate. That creates a much more powerful financial incentive to actually follow the rules, maintain adequate staffing, and treat residents with basic dignity. The bill also establishes new transparency requirements. Nursing homes must now make inspection records, staffing data, and violation histories more readily accessible to the public. When you are researching a facility for yourself or for a family member, you will have access to actual documented records rather than having to rely on what a facility chooses to present in its marketing materials. And that access matters enormously. A family doing their research today will be able to look at a facility's actual inspection history, see how many violations have been recorded, understand whether those violations were addressed or repeated, and make an informed decision based on real data. That is a fundamentally different situation from what existed before, where a family might tour a beautifully maintained lobby and have no easy way to find out what the federal inspection record actually showed. On the issue of elder financial fraud, this bill makes significant investments in prevention, prosecution, and public education. Older Americans lose tens of billions of dollars every year to scams and financial exploitation. The methods vary enormously. Fake government calls, Medicare fraud, impersonation scams, investment schemes, romance scams that specifically target widows and widowers, dishonest contractors who collect a deposit and vanish, and financial exploitation by family members or caregivers who have gained access to an elderly person's accounts. The FBI has consistently identified elder financial exploitation as one of the fastest growing crime categories in the United States. Many victims never report what happened to them because of shame, confusion, or because they did not fully realize what had occurred until it was too late. The emotional aftermath of being defrauded can be as damaging as the financial loss itself. People describe feeling stupid, embarrassed, and violated. They question their own judgment in ways that can last for years. And in many cases, the money that was stolen represented savings built over a lifetime that simply cannot be replaced. The Elder Care Protection Bill creates a dedicated funding stream for elder fraud prevention and prosecution, meaning more federal investigators specifically trained to recognize and pursue these cases, more resources devoted to victim support and financial recovery, and stronger coordination between federal agencies, state and local law enforcement, and financial institutions. Banks and credit unions are now positioned to play a much more active role in identifying and reporting suspicious activity in accounts belonging to older customers. Sudden large cash withdrawals, multiple wire transfers to unfamiliar accounts, unexpected changes to account ownership. These patterns can be red flags for exploitation, and financial institutions now have clearer authority and responsibility to act on them. The bill also invests in large-scale public education campaigns directed specifically at seniors because awareness truly is the most effective prevention tool available. When you understand the tactics that fraudsters use, when you recognize the warning signs of a scam before it fully unfolds, you are far less likely to become a victim. And when communities talk openly about these schemes rather than treating them as something to be ashamed of, it becomes harder for fraudsters to operate in the silence and secrecy they depend on. On housing, the bill substantially expands funding for home modification assistance programs. Many seniors want to remain in their own homes as they age, but the physical layout of a typical home was not designed with later life in mind. Stairs, narrow hallways, bathrooms without safety features, and kitchens that are difficult to navigate in a wheelchair or with limited mobility become real barriers to independence over time. The cost of making necessary modifications, installing ramps, widening doorways, adding walk-in showers, improving lighting, can run into the thousands of dollars. Through grants and low-interest loan programs, eligible seniors can now access financial assistance to make those modifications. Remaining at home is not just a matter of preference for most people. It is deeply connected to their sense of self, their mental health, and their quality of life. A person who can stay in the home they have lived in for 30 years, surrounded by their memories, their neighbors, and their community, is in a fundamentally different situation psychologically than someone who has been placed in a facility before they truly needed that level of care. This bill recognizes that and invests accordingly. The bill also invests in expanding the supply of affordable senior housing options, communities designed with accessibility features, proximity to healthcare, and opportunities for social connection built into the design. Social isolation among older adults is a serious and under-recognized public health issue, and intentional community design is one of the tools available to address it. The bill also makes meaningful progress on expanding mental health access for Medicare beneficiaries. Grief, anxiety, chronic pain, loss of independence, these are real emotional burdens, and the barriers to getting professional support through Medicare have historically been significant. Too many therapists and counselors simply do not accept Medicare patients because the reimbursement rates have not made participation financially viable for their practices. That has left a large population of older adults with genuine mental health needs and very limited access to professional support. Improving reimbursement rates for mental health providers and expanding telehealth options will make care more accessible, particularly for seniors in rural communities or those with limited mobility. The ability to speak with a trained counselor from your own home without having to arrange transportation or navigate a waiting room removes several of the practical barriers that have historically kept older adults from seeking help. Family caregivers, the estimated 53 million Americans who are providing unpaid care to aging loved ones, are also addressed in this legislation in ways that are long overdue. Caring for an aging parent or spouse is one of the most demanding things a person can take on. It affects your work, your own health, your relationships, and your finances. New tax credits, expanded training programs, and improved access to respite care represent a genuine acknowledgement that caregiving is demanding, costly, and deserves real support from the systems that benefit from the work caregivers do every day. As for the Senior USA Guide on what to do right now, your first stop should be your local Social Security office or the official SSA website to understand how these changes apply to your specific situation. Every state has a State Health Insurance Assistance Program, commonly known as SHIP, which provides free, unbiased Medicare counseling. These counselors exist specifically to help you understand your benefits and navigate changes exactly like the ones this bill introduces. They are not selling anything. They are not affiliated with any insurance company. Their only job is to help you understand what you are entitled to and how to access it. If you have not already connected with your state's SHIP program, this is an excellent time to do that. One critical point to remember: be very careful of anyone who contacts you offering help claiming new benefits under this bill and asking for money or personal information up front. Scammers watch for major legislation because it gives them a convincing and timely reason to reach out. Within days of a major bill passing, Fraudsters are already crafting pitches around it. They will call you, they will email you, they will set up websites that look official, and they will use the language of the new law to make their pitch sound credible. Legitimate government services are always free. The Social Security Administration will not call you and demand immediate action. Medicare will not ask for your credit card number over the phone. If anything about a contact feels wrong, hang up, close the browser, and reach out directly through official channels you look up yourself. This bill is not a perfect solution. No legislation ever is, and it would be doing you a disservice to suggest otherwise. There are still funding battles ahead. Implementation takes time and does not always go smoothly. The industries and interests that benefit from keeping things the way they are will continue to push back through lobbying, litigation, and political pressure. But what this bill represents at its core is a real and substantial commitment to addressing the daily challenges that older Americans have been facing for far too long. The best way to protect what has been gained here is to stay informed, understand what you are entitled to, and take the steps to access what is available to you. Subscribe to this channel and turn on the notification bell so you do not miss future updates on topics that directly affect your retirement, your healthcare, and your financial security.